Welcome to Jodie in Malibu. I'm Jodie, and today's guest is Dr. David Ghozland. I'd like to welcome you to the show.
Thank you very much.
Thank you so much for coming. We're going to touch on a topic called vaginal rejuvenation.
Yes.
Why don't you describe what it is technically?
Well, vaginal rejuvenation, let me just quickly say that there's multiple words to describe it. It's either called a vaginoplasty, or sometimes you'll even hear it called a vaginal facelift. What a vaginal rejuvenation is simply after many years of, let's say, childbearing or just simply normal age and gravity, there is a change in the texture and the tissue of the vagina. What I'm able to do with the vaginal rejuvenation techniques is actually go deep into the muscles of the vagina underneath it and retighten the muscles, giving a stronger, more frictional feel to the vagina.
I see. What are the surgical procedures that you do for this?
We do for vaginal remodeling, we do what's called a vaginal rejuvenation, or as I explained, a vaginoplasty. We also do labiaplasties, in which we remodel the labias for women depending on how they want them and how they want their look. And we also do what's called G-spot amplification.
And how long a surgery is it? Is it done in your office? Is it done in the hospital?
Actually, depending on the patient and the patient's risk factors, it can either be done in a surgery center as an outpatient, or I can even do it safely in my office using twilight anesthesia.
Oh, really? And how about as far as the recovery period?
The recovery period is approximately about 6 weeks, and that's not in-bed recovery. That's simply just being a little bit sore and not utilizing your vagina, nothing inside the vagina for 6 weeks.
I see. So what type of women usually do this? Is it something that you recommend, like when you're examining them, or is it something that they...
I usually bring it up, not so much during the exam, more in the sense is, are you satisfied with your sexual life? Mm-hmm. Do you feel that during intercourse you're still having the same kind of not, I don't want to say orgasm, but the same kind of friction during intercourse? If the answer is no, and oftentimes it is, especially after having 1, 2, 3 children or more, then I bring it up and I introduce this new technique that I've developed with many others, and I explain to them how it's done and what the outcomes are for them. And I've seen it in my practice that it has changed relationships drastically.
Really?
It benefits not only the woman and it makes her feel better and more empowered, but it also allows the man to feel more friction during intercourse.
So the man feels the difference also?
Absolutely.
And what age is there a certain age this usually happens? Or?
Usually I recommend doing an actual vaginal rejuvenation after you're done childbearing. That way there's no destruction of tissue if you have another child vaginally. And we also do labiaplasties either alone or in conjunction with a vaginoplasty.
Now, a labiaplasty
a labiaplasty is, the labias that are on the outside of the vagina sometimes are elongated, just naturally. Sometimes they're asymmetrical. One is longer than the other. And oftentimes, especially in younger women, it's a little bit embarrassing even at times to wear tight clothes or bikinis because they may protrude or irritate them. Or if they're athletes, they may also bother them secondary to chronic irritation. Or during intercourse, as when the head of the penis is entering into the vagina, there is a little bit of redundant tissue secondary to the labias causing pain.
Oh, really?
And so what we're able to do with a labiaplasty is actually show images and allow the patient to pick their desired look, and are able to trim the labias for them to make it more comforting, more aesthetically appealing to them.
Do you find this also common in women that have not had children?
The labiaplasties, absolutely. Vaginal rejuvenation, sometimes with time, gravity does make changes without having any children, and we absolutely offer to them, why not, if it makes them feel better. Yeah. If during my exam I feel that my vaginal rejuvenation is not going to add much, then I absolutely would not put them through surgery.
Now, how about a woman who's had hysterectomy?
Makes no difference.
That makes no difference?
Absolutely not. A hysterectomy is removal of the uterus without touching the vagina. I'm simply working in the vagina up to the cervix or the vaginal cuff if they've had a hysterectomy.
I see. So there's only 6 weeks, you say, of...
Yeah, the recovery period is quite rapid. It's about 1 to 2 days of mild discomfort afterwards. Obviously, they're given pain medication to go through it. And then it's just a period of allowing the tissue to re-epithelialize and to heal on its own.
I see. Here's a question for you.
Sure.
Do you find that many adult film stars have something like this done, since the industry is focused on that area?
Absolutely. I think it's a procedure that's becoming even ever more popular, and the reason being is that I think for a long time it's sort of been taboo to talk about your labias.
Right.
But the truth is, it's a body part, and if it makes you feel uncomfortable and the technology is there to give it a really good fix, why not take advantage of it? Mm-hmm. And you find that in the adult industry, oftentimes if the labias are a little elongated, they have pain during intercourse.
Yeah.
And so they opt to go ahead, and I'll show you some pictures later on in the show in which I'll demonstrate what I call my Playboy look, and that's removing the labias and allowing it to be flush to the labia majora, and allowing a very clean looking appearance.
And the labia majora, for people that may not know, is the outer...
Is the outer area of the vulva, yeah.
That's right, because a lot of people don't know the medical term.
No, absolutely.
I would have thought it was like vaginal reconstruction, but I guess it's similar to
that's exactly what it is. It's really pelvic vaginal reconstructive surgery. Mm-hmm. It's just, I think it's glitzier to say vaginal rejuvenation.
And you call it the Playboy look? That's so cute.
Right.
Every woman's going to look like they belong in Playboy, right?
And they should feel that way, and that's why we do it.
Well, that's true. I guess if you feel good about that area, you're going to have a better sex life, and you're going to feel...
Absolutely. I think you feel more secure, you feel more empowered, you feel more confident. And not only that, there's also the actual physical difference that you feel.
I see. Do you do also like reconstruction for women that maybe have been castrated, like, in other countries they get castrated? Do you do anything like that?
I do not. That's actually, and the reason I do not is unfortunately, luckily in the United States we don't see cases that often, and so my expertise in that area is not there, and so I would never perform that kind of surgery. As opposed to vaginal rejuvenation, where I've done hundreds of cases now, and I feel that I'm actually at the forefront of the field and able to remodel and give a nice contour to the vagina.
Where did you, now you were born in?
I was raised in Paris, France, but I moved here when I was young. I went to USC and trained in New York at St. Vincent's, and after graduation I actually continued my surgical training in vaginal rejuvenation.
And you're out here in Los Angeles area at St. John's?
I'm here in Santa Monica and in the Beverly Hills area.
Right. So we want people to know that, even though we will have your website up.
Fantastic.
I know what I wanted to ask you also, which all women talk about. Many years ago, about 20, Cosmopolitan magazine came out, the G-spot.
The G-spot, yes.
And, a lot of women don't feel they have one. They don't know anything about it. Is there a G-spot?
There actually really is. I think most people do not exactly know where it is. It's actually located within the vagina, not on the outside of the vagina. It's actually located on what we call the anterior, or the top portion of the vagina, towards the front. And it's about a dime-size area. And what I do with my G-spot amplification is simply I inject a sort of a filler into the area in order to increase its size. And so it's a mass-occupying space. And so therefore the theory behind it, and it works dramatically, is that if you're able to enhance that area and you're causing friction to it, and there's more space involved in that G-spot, then your orgasm is going to happen quicker and stronger.
So you can have, like you say, a vaginal orgasm from the G-spot rather than clitoral.
Absolutely. And you'll find the same thing with a vaginal rejuvenation. I constantly, some of the feedback that I get from the women I do is that, wow, Dr. Ghozland, I can't believe it. Not only do I feel better, but during intercourse, I've never felt such strong orgasm, and that's because I'm able to tighten the vagina to a point that it actually really allows intercourse to feel every contour of the vagina, including the G-spot.
I see. So there is a G-spot.
So there is a G-spot.
And they also, I've heard the G-spot can cause female ejaculation.